actually not a specific medical definition for walking pneumonia. It's more of a catch-all term or something we use in place to describe a constellation of findings. Basically, someone who has what seems to be like a pneumonia, but it's not sick enough to land them in the hospital or need oxygen or need a lot of aggressive treatment and therapy, we can just call that walking pneumonia. This is where it actually gets a little more tricky, because the two main ways that we can diagnose walking pneumonia that's probably more commonly used, number one, is a nasal swab, and specifically it's one that tests for a lot of different types of infections. So the ones that we usually test for in the office are going to be things like testing for COVID, testing for flu, testing for RSV. That just tends to be the more common ones. Usually in the office setting, in order to test for tons of different organisms, you have to send it out to the lab, or if they're in a place like the emergency department, sometimes they have more easier access to using those tests. But the thing is, not every child needs to have all the tests. This is where we say in medicine, what's the difference between an actual problem where it's actually affecting the child, and what's the difference between a finding where we found something but it actually doesn't affect the child. So therefore, not everyone needs to be tested, but that's one way you can test. Another way that you can test, which can never tell you definitively, but it gives you hints, is a chest x-ray. So in an x-ray, sometimes you'll see a lot of fluid in one area, and that's when it's very clear that, okay, you've got a certain type of pneumonia, usually more of your classic type of pneumonia. But a lot of times with the atypical pneumonias, or walking pneumonias as we call it, you may just see, maybe it's just a little haziness on both sides of the chest, but it's one of those that it can be kind of hard to pare down. It's not something that's obvious, but maybe that represents something that could be a little bit of pneumonia. And sometimes the radiologists, when they read that, they'll just say clinical correlation indicated, which is basically a fancy term that just means look at the child, what the symptoms present. The x-ray is not going to tell us everything, but it can definitely give us good hints. In general, if we just take a step back and just look at these symptoms, they look very similar to a lot of respiratory illnesses. So I would say that if it looks like your child has a cold, then I would say it's okay to treat it like a cold. But if they're having fevers more than 5 days, they've got a severe cough that's just more than just your typical one, they're just very tired, low energy for multiple days in a row, and it doesn't seem to be getting over that hump, and they're not getting better. These are general times when you probably can consider taking your child to the pediatrician or to your primary doctor to get looked at, because then, is walking pneumonia one of the things that could be out there? Sure. But it also could be a lot of other things. Some of it is infectious, like certain infections we've been talking about. Some of it is non-infectious, like asthma or allergies. And of course, the doctor can help to pare down and see which one of those it is and what's the best way going forward. And if we were to take a step back and just view this from a big lens, this is how I like to view anything that comes through the media. Number one is, of course, first of all, if there's any questions about what goes out, it's always good to talk to your local pediatrician, your doctor, just to get their opinion and what they think, because we can definitely offer a view in terms of what we see in the office, coupled with maybe there's some good information online from reputable sources that try to give a good sense of, is this something that actually I need to be worried about or not? And that comes through the data that comes out. So therefore, when it comes to this, in general, over the years, we tend to see certain diseases, whether they be certain types of viruses, maybe certain types of bacteria, sometimes they tend to kind of ebb and flow. And I think one of the more recent phenomenons that we are familiar with is the craziness that happened during the COVID pandemic. When we saw COVID surging, we thought that we're going to also see this surge in a lot of RSV cases and flu cases, and in essence, during a good period of time, COVID was taking a lot of the stage, and we didn't see that much flu and RSV going around. But then as COVID sort of morphed into what it is right now we're starting to see some RSV cases, flu cases. So far here, I haven't seen as much here just yet, but I know just trends in general each year, usually the fall season, winter season, this is when flu, RSV tends to come up and down. Some years they go up more, some years they go up less, and it just depends. I've been speaking more in general terms of the generally healthy child. General healthy child is they don't have any major medical conditions, their immune system is pretty much healthy, they're not born severely preterm, and they're very young, they're up to date in their vaccinations, etc. So your general healthy child, this is where what I've been talking about applies to most of these children. Of course, if a child is having severe immunocompromised disease, therefore their immune system is lower, or they're not up to date with their vaccinations, or they're around other individuals where their immune system would be lower, whether it's a medical condition, cancer, etc. Those are the cases you definitely want to be more careful, and that's where I would seek specific advice from your child's pediatrician to know what should you do in certain cases. Anyway, I hope this answers some questions about walking pneumonia and clears some of the air. I know it can be a little confusing when we use these different terminology, so if you have any questions, definitely reach out to your pediatrician if you want to hear more from me and get to know our team. My name is Dr. Michael Tjahjadi with Iredell Pediatrics, and you're more than welcome to give us a call. We are accepting new patients if you would like to become a part of our Iredell Pediatrics family. So, all right, thanks for listening and take care.